Hello everyone, my name is Shafira and now I will tell you guys about how to protect ourselves from Omicron variant COVID-19. So let's talk about Omicron first. I know it's a never-ending story if we talk about COVID-19, but let's talk about this new variant. So what is Omicron? The Omicron variant is a new variant of COVID-19. The Omicron COVID-19 variant was first reported in South Africa on 24 November 2022. It is quickly spreading across the world. The World Health Organization (WHO) declared Omicron to be a COVID-19 variant of concern based on preliminary evidence that it spread quickly. Researchers around the world are trying to work out whether existing COVID vaccines protect us from the latest variant, Omicron. The worst-case scenario is the virus has mutated so much in the crucial part of its genome that it can escape COVID vaccine designed to protect us from earlier versions of the virus, with devastating consequences globally. But it's too soon to panic, and vaccine may end up protecting us against Omicron after all, as they have done with earlier variants. No. Hello everyone, my name is Shafira, number 22, and now I will tell you guys how to protect ourselves from Omicron variant COVID-19. So let's talk about Omicron first. I know it's a never-ending story if we talk about COVID-19, but let's talk about this new variant. So what is Omicron variant? The Omicron variant is a new variant of COVID-19. The Omicron COVID-19 variant was first reported in South Africa on 24 November 2022. It is quickly spreading across the world. The World Health Organization (WHO) declared Omicron to be a COVID-19 variant of concern based on preliminary evidence that it spread quickly. Researchers around the world are trying to work out whether existing COVID vaccines protect us from the latest variant, Omicron. The worst-case scenario is the virus has mutated so much in the crucial part of its genome that it can escape COVID vaccine design to protect us from earlier versions of the virus, with devastating consequences globally. But it's too soon to panic, and vaccine may end up protecting us against Omicron after all, as they have done with earlier variants. Persons infected with the Omicron variant can present with symptoms similar to previous variants. The presence and severity of symptoms can be affected by COVID-19 vaccination status, the presence of other health conditions, age, and history of prior infections. Those symptoms are sneezing, coughing, sore throat, headache, and runny nose. So what should we do to fight this new variant? How to protect yourself and others from Omicrons? Here's what we needed. We need vaccine booster, we need mask, testing, hand sanitizer, hand soap, and disinfectant spray. So there are many steps. First step is vaccine boosters. Getting vaccinated and staying up to date with COVID-19 vaccines is the best way to protect yourself and others against the Omicron variant. CDC recommends that everyone 5 years and older protect themselves from COVID-19 by getting vaccinated. Everyone aged 12 years and older should stay up to date on their COVID-19 vaccines and get a booster shot when eligible. The federal government has begun the process to make younger teenagers eligible for booster shots. The United States Food and Drug Administration on Monday authorized boosters for 12 to 15 years old, but the United States Centers for Disease Control and Prevention must make a recommendation before the shots are made available for that age group. The second one is wear a mask. I mean, who doesn't wear a mask in this situation? To reduce coronavirus spread, health officials are urging people to use masks that are medical grade such as surgical or blue or N95, KN95 or KF94 masks. Wearing an old loose cloth mask alone is less effective. Placing a cloth mask on top of a surgical one can be more effective than a surgical mask alone as it tightens the fit. The California Department says that good masks have the following properties. 2 layers of tightly woven cotton with a third layer of non-woven fabric. The third layer could be an inserted mask filter or a synthetic fabric, such as polypropylene. Nose wires to reduce gaps around the nose. Adjustable ear loops or straps that go around the head to reduce gaps around the face. The third one is testing. Tests can tell you if you have COVID-19. Two types of tests are used to test for current infection: nucleic acid amplification test (NAATS) and antigen tests. NAAT and antigen tests can tell you if you have a current infection. Self-tests can be used at home or anywhere, are easy to use and produce rapid results. If your self-test has a positive result, isolate and talk to your healthcare provider. If you have any questions about your self-test result, call your healthcare provider or public health department. Individuals can use the COVID-19 viral testing tool to help determine what kind of test to seek. You can find it in pharmacy or even online shops. The fourth one is hand sanitizer. Bring hand sanitizer wherever you go and use it after whatever you do. Just spray it on your head and to minimize the virus contaminating your body. Number 5 is to use hand soap. Wash your hand after you do activity. Always do it. Number 6 is disinfectant spray. Spray your clothes and things when you get home. And also spray your room with disinfectant spray so that your room stays clean and safe. Number 7 is stay at home. I know you're getting kind of bored, but please don't go anywhere unless you need to go. This variant spreads very fast, so be safe around public places. So here are more tips. Get tested before travel, upon return, and again 3 to 5 days later. Take advantage of quick and easy at-home test kits available in pharmacies and stores. Outside gatherings are safer than indoor gatherings. Limit the number and size of indoor gatherings. Layer your defenses and reduce your household risk exposure during periods of high transmission, like the current Omicron surge. Have everyone age 5 and older get their COVID-19 vaccination and booster if eligible. Anyone who develops symptoms of COVID-19 should isolate themselves and get tested as soon as possible. So that's all from my presentation about how to protect ourselves from COVID-19 new variant Omicron. I hope everyone stays safe and healthy, and thank you for your attention and have a nice day.